Hello, and thank you for joining us on the Stay Healthy Knoxville podcast, brought to you by Simply Physio, aimed at helping you live an enjoyable, fit, and healthy life in and around our community of Knoxville, Tennessee. And now, here is your host, Dr. John Mark Chesney.
Welcome to Stay Healthy Knoxville. I'm excited to introduce our guest today, Dr. Raye-Anne Ayo. She's a board-certified family medicine practitioner, is living her lifelong dream of serving the complete healthcare needs of her community. She understands that one size does not fit all when it comes to patient care, which is why she offers concierge medicine services at her private practice, which we'll be talking about the first half of our show. The name of her practice is Family Health Center, PLLC, and it is here in Farragut, Tennessee. Dr. Ayo knew she wanted to pursue medicine from her earliest memories. Originally from New Orleans, Dr. Ayo stayed in her hometown for medical school and earned her degree from Louisiana State University School of Medicine. Advancing through school and into her residency, she felt drawn to the role of family practitioner. Though she knew there were higher profile fields, she loved the unique opportunity to truly connect with her community where she lives and works. After completing her residency in family medicine at the University of Tennessee Medical Center in Knoxville, Dr. Ayo went on to pursue her fellowship training in age management medicine from the Foundation for Care Management and the Kinegenics Education and Research Foundation. Dr. Ayo is currently in a fellowship program for functional medicine, and she opened Family Health Center with the goal of providing her community with the personal attention and medical solutions they need. She loves the fact that every day is different and enjoys being more than just a doctor for her patients, whether it's a shoulder to cry on or an ear to listen. Dr. Ayo offers her patients the individual care and attention they need each day. Her personal philosophy is to treat others the way she wants to be treated, which extends not only to her patients, but her caring and professional team as well. When she's not working with patients, Dr. Ayo loves reading, cooking good food, and spending time with her 3 growing sons. Her oldest, which she'll be going to watch soccer here once we finish our recording. Welcome to the show, Dr. Ayo.
Thanks for having me.
Definitely. Well, we like to get started just really hearing the story behind the story and just how you got interested in medicine and what really drew you to a family practitioner type of medicine.
Okay. So when I was young, I had a sibling, a younger sister. She was 3 years younger than I was, and she was born with a congenital heart disease. Mm-hmm. And so she was always in and out of hospitals. And there was a couple of doctors who really took special interest in her, and it made a world of difference to my family. And she did pass away when she was 8 and I was 11.
Wow.
But always I felt that their interaction with my family was absolutely spectacular. So, and I like science. And so that was always that's what I wanted to do, is grow up to be a doctor. Now, family medicine, I didn't know what I wanted to do in medical school. I was like, well, we'll just play it by ear, and learn about all these things. And then you start rotating and doing all your clinicals and different slots. And you have to make some decision as far as what residency to apply to. And I just gave myself until the last minute almost. Mm-hmm. And it's funny because you're so tired at that point. And some of these rotations, I just couldn't wait for them to end. Mm-hmm. But family medicine, I woke up on the last day and I still liked it. And so I didn't hate it. And I was like, oh, maybe this is what I want to do. So, and my mentor at the time, we did a lot of stuff. We delivered babies. He was a surgery resident prior to doing family medicine. So he did a lot of procedures in the office. And so it was constantly changing. So you never knew what was behind the door that day. And that kept it interesting. It kept it like, I know that I'm not going to do the same thing. And it's not that specialists do the same thing for everybody. That's not true. It's just, if you're in neurology, you're going to do neurology that day. I might do, colds and pediatrics and do procedures. And So my day is pretty varied. And that's why I like that a lot.
Yeah. Kind of keeps you on your toes, but also I'm sure keeps you engaged and learning too.
Yeah. There's a lot of questions.
So you, you got up to Knoxville by way of, was it your fellowship program?
My residency.
program.
Yep.
Okay. And then from there just stuck around?
Yep. Had one child in residency and then got a first job. I had another kid. And then I wasn't as happy as I wanted to be as an employed physician. So kind of hung up my own shingle and had a lot of attendings. I'm still clinical faculty at UT in the residency. And at the time, some faculty were like, you're nuts. Like nobody does that anymore.
To hang up your own shingle.
Right.
And when was this? When did you actually?
January of 2008.
Okay.
Yeah.
Okay. So about
11 years ago.
Yeah, 11 years ago. Okay.
Yeah, I know. It's a big birthday. So, but I did, and I didn't have any patients, and that's a little weird and scary. But I still have that very first patient. I remember the very first copay, and I remember that person calling and going, "All right, are you going to be around a while? Because I don't want to find another doctor." I go, "Yes, I'm going to be around." And shortly after I opened the practice, I found out I was pregnant with my third child. So I was like, beautiful timing. Open a practice and I'm going to take a couple months off in a year. Okay. So, but it all worked out and we're still around 11 years later, which is great. So
now I know a little bit about your practice, but I'm sure most of our listeners do not. So, part of it is if you explain to our listeners how it's set up uniquely than maybe just your traditional family practice.
Maybe it's easier if I just go through the progression of how I came to changing it.
Sure. Yeah. So you start off a traditional
medicine. Because when you have no patients, you just want anybody to come in the door, right? And word of mouth and very minimal advertising I'm very blessed. And so the practice grew. And over time, I got to where I had 3,600 patients, individual patients. And
you were the sole physician?
Yeah, I'm the only person there, right? And so the way I wanted to run the practice and why I started it was because I wanted that customer service and that individual attention, and where nobody has to, when you call in, have to go to a computerized phone tree. You get a person, and that if you're sick, we want to be able to see you the same day. And because again, that's kind of how I would want it. If I'm sick, I don't want to be seen in 3 days. I'm either going to be dead or better, whatever. So, like I said, the practice grew, but at that same time, delivering that level of customer service and patient care, wait times were getting longer.
Sure. There's only so much you can do. That many people.
Right. And if somebody was having a rough day and needed me, it took a little longer in the room because they were really having a tough time. I'm just not that type of person going like, I need you to hold that and I'll be back next week, or please come back next week and we can talk about that. So, for various reasons, the wait time got longer, and seeing 25, 30 patients a day. And you needed to see that just because of decreased reimbursements from insurance, et cetera. So it's a business production. So, but I didn't want my production to be shorter time frames for people's healthcare.
Sure.
So over the years, I've been reading through medical economics about concierge medicine or boutique medicine or direct patient care. I mean, you can call it a bunch of different things, but the idea is that you have a smaller patient panel and you're able to give longer appointment times and do a different level of, medical care for them.
Care and service and attention.
Right. So, 2.5 years ago, I changed my practice model from traditional seeing 25, 30 people a day to a concierge practice where still accept insurance and still bill insurance, but there's a membership fee, and that membership fee goes towards a personal checkup once a year so that we do extra and a deeper dive into your health care that is covered by that membership fee. And I never bill it to insurance. It also allows me to give people my cell phone number so that they can call and text, and it's the same person after hours every single day. And also spend longer time. So your average visit is 40 to 60 minutes long, so we can get a lot done in that time frame, and I'm on time. So usually people are coming in the door and they go right back to the room. So your effectiveness for the patient is a lot higher. And it allows me anyway to be able to listen to the whole scope of what they're going through and try to find results and solutions that may work in their life versus, we've got to do this and this. And they're going, that is not even functional for where I am in my life. I also understand the fact that it's not for everyone, either, it's not affordable, or that's not where they need it. Like they're like, I may come in once every 4 years. I don't need that right now, So I do have a nurse practitioner, and she has the traditional medical model. So it's quicker visits, but again, some people that's fine for.
Meets their needs.
And so that way,
like the two legs
of it, so that nobody needs to feel that they can't come to the office, So that's nice.
Yeah. So you said about 2 or 3 years ago was when you decided to change gears and open up the concierge side of your practice.
Yep.
Okay.
It allowed me also to kind of use the age management fellowship knowledge, and now going along with some functional medicine knowledge, and that just takes a little bit more time. So it's beneficial that way too.
Nice. Was you can imagine making like a pretty big change in your practice. How were you as far as like, was that pretty scary making that change, or did you kind of know what to expect, or were things pretty open-ended?
I actually worked with a company that helped me transition, so that there was somebody in the office trying to help explain. We did some open houses and helped to explain, because people that, I've been their physician for years, an obvious and legitimate question is, why? Why do I have to pay extra? And the real life answer is that I wasn't getting sleep. I was sleeping 3 hours a night for a year and a half before I made this transition, trying to be mom, physician, and working all of it in my day, which I really just wasn't
being very sustainable.
Yeah, it's not. So the real life answer is like, because I can't do this anymore. I can't. This is not a good thing. You want me to have more than 3 hours of sleep. I want you to have that, and so I had to make a change just for my health also. So it's really worked out nicely. I feel, especially for families, it's neat, or people that travel a lot for work or pleasure or whatever. But it's nice to have the same person on the other end of the phone, or when the school calls and says, hey, my kid's sick. Well, yeah, just bring them on in instead of having to wait a couple of days or whatever. So it's worked out really nicely.
So with the concierge medicine side, with people that are kind of interested in, like, is there a certain like type of client or person who like has certain characteristics that would be kind of a good fit, certain values, or like if you were to describe your kind of typical kind of client?
They range from just I need the same person to call because I travel and I'm really busy and I need X, Y, and Z type of thing because that fits in their lifestyle, to somebody who is just because I have a bunch of kids and I want the same person on the other end of the phone, to somebody who's really interested in preventive health care. Not that most aren't, it's just that's just another characteristic of somebody who might, this might interest, because we're going to do a deeper dive into your healthcare and look at it a little differently. So, I work with, specialists like you, and I have, different people that we refer to that share that same philosophy. Like, I want to keep you healthy and prevent the train wrecks versus adding, well, okay, I didn't catch that one first, or then I'm trying to, again, it's just kind of prevent the train wreck.
Sure. Yeah. And that's, the same like values. It's very similar. I very much identify with that. And the reason I start up, my practice, to be able to offer somebody, another alternative, because they can go, to like, and somebody may be happy with 8 minutes with their physician, especially if, maybe they hardly ever go to the physician or, but, somebody who just, values, the time and really, able to tap into, I'm sure, your expertise. Like, you can't deliver that like when you're kind of hamstrung to like, 8-10 minute type of, visit. It really, I'm sure, boils down the expertise level able to, deliver an appointment when time is such of a crunch.
Yeah. I don't feel great about, when somebody has like 3 or 4 issues going, I don't have time for that today. And I have to ask you to come back because I have to get to the next person to be on time for them. And because everybody's time is important. And I hated, when people had to wait. But I think in turn, they knew that if they had a bad day, that I would be sitting there with them and wouldn't move until everything was kind of settled.
So, you mentioned too that you started a fellowship in functional medicine. So, or one, I think that really speaks a lot to like what you value, like, having had an established practice for 11 years and, choosing to jump back into, I'm sure it's a rigorous type of program.
Well, thank goodness I have 7 years to finish it. Okay. So,
But still, that's definitely, not everybody has that mentality of, it sounds like you really have the love of learning. Because if you didn't, there's no way that you would venture into, I'm sure, a challenging program like that.
Yeah. Some of it is is almost selfish knowledge, because, as I'm getting into my 40s and I'm changing and how I heal, or how I'm, like, man, why do I want to faceplant my computer every day at 3:00, So some of it is almost selfish, because obviously I hear it, from others, and like, I gotta start figuring out why, what can I do to make this a little bit better?
Sure. And then even, I'm sure functional medicine, is a term that people have heard of, but they may not know actually, like, what does that actually mean? How's that different than traditional medicine, functional medicine?
So the goal of functional medicine is trying to get to the root cause of diseases or disorders, or how your body's responding to the environment that it's in, really. So what I like about it is it still uses evidence-based medicine and things that have studies and things behind it. But it's looking at, okay, we think that diabetes and heart disease is more due to inflammation. Well, what's causing the inflammation? What can we do to change that part and therefore help the diabetes and the heart disease type of thing? So not necessarily labeling everything, because, you and I know that there are some things in our bodies, and people ask me and I look at them and say, I just don't know why that is happening right now. So I don't know. I can't label it for you. But we can try to look back and see maybe why it's happening, even though I don't know what it is. But see if we can change the environment of your body, and maybe that'll get better.
Sure. Are there certain, when you talk about changing the environment of somebody's body, are there typical, methods or interventions that happens for how people change that environment?
Yeah, people hate it when I say this. They always say, well, what can I take or what can I do? And really, functional medicine is really, really slow medicine, right? And
slow, you
slow
mean-
time.
Like the results like that people see, it takes some time.
Yeah, because what we're going to say is, okay, we have to manage your stress better. Well, okay, what do I do about that? Meditation, exercise, whether that be prayer, meditation, or a guided meditation, food intake. What are you exposing your body to? So, sort of the whole bunch of vegetables come in, and not any processed sugar. And I mean, we know consciously that I know I need to eat more vegetables. I know that this is better for me than going through the drive-through. It's not the easiest at all. It's not the easiest to try to get 8 hours of sleep when, you've got kids waking up or kids to go get, and well, the winter formal doesn't end till midnight, Mom. I mean, come on. So, it's not easy. And that's, I think, the part that, of course, we all want answers yesterday, and I would love to give results yesterday. That's for sure. It just doesn't happen that way.
Yeah. I'd imagine that when the solution oftentimes isn't as complicated as what we feel like it needs to be, that is that offensive to some, or like how they handle it, like kind of saying, hey, it's not about just making the prescription for the next, medication to cover over the symptoms. Yeah, that'll probably take care of the symptoms, but is it getting to the root of the issue? Yeah.
Sometimes it isn't. It's not as a welcomed answer. It's like, I need you to exercise. I know. Or starting the meditation and looking at the science behind it. It's interesting, though, to see the follow-ups when people really do take you seriously and really do start to implement that. So, in 6 weeks, we have blood pressure drops, we have weight loss, we have some different things like that. And those things are really cool.
Yeah. I talk, like the meditation is oftentimes key for people I work with, as far as that are in just high kind of stress related pain and tension, right? And I'm interested in how you recommend like somebody even get started in meditation. If you have any helpful tips in that regards.
Well, the mindful breathing is easy to start with, and there's different things about that. But I usually recommend some free apps initially, like Headspace or Calm, and just to at least get started with some of those. Some of them are as short as 2 minutes long, which, of course, we want them to meditate about 15 to 20 minutes. But doing that when you're really stressed is about as successful as, saying don't eat the cookie to the little kid holding the cookies, right? So I just look at people and say, look, you can give yourself 120 seconds and just start there and just see what that does. Just see how you feel right after the 120 seconds. And so usually it'll catch on just a little bit. Like, I know I feel better when I do that. I just have to make time, so.
Yeah, I know there's a number of studies looking at, people with chronic pain and mindfulness, and how, compared to, pain medication, and how it's really, running, neck and neck with often, without all the harmful side effects, like we're in here in Tennessee with the opioid epidemic and all that, and how a lot of people don't realize like the power of a clear mind and unweighting, the mind in that type of practice.
Yeah, it's interesting.
Well, great. We're going to take a break to hear a word from our sponsor, and to let you guys know, the second half of the podcast, we're going to talk about some women's health subjects issues. And if there are any young listeners out there, we would recommend them not listening to the second half. It's more sensitive women's health. So this is more for our adult listeners.
Stay Healthy Knoxville is sponsored by Simply Physio, a physio clinic that equips and empowers you to live your life to the fullest so that you can enjoy the things you love to do and be the person you are made to be. Simply Physio specializes in helping people get back to a healthy and active lifestyle, living free from pain and medication and avoiding unnecessary surgery. Stay tuned until the end of the episode to receive a special gift from Simply Physio and enjoy listening to the rest of the episode.
Well, welcome back to the second half of our show. So here with Dr. Ayo, and we want to transition the rest of the episode to talk about some specific women's health issues. And interested in Dr. Ayo, how you developed an interest in women's health, like how that all transpired.
I think most physicians attract a very similar patient population to themselves, right? Mm-hmm. So over time, I have a lot of moms and a lot of female patients. They drag their husbands in too, so that's how I got male patients. And I also do vasectomies, so that's just a different interest of mine. Again, it's kind of variety, but I did that since residency. But the female health, again, kind of selfish driven. I'm female, I'm now in my 40s. I've had 3 kids. I'm trying to at least stay active. I've personally had a hip replacement. So, that's just a whole different thing, a ball game to get over in physical activity, et cetera. But you find that even traditional medicine is just not giving you the success rates that you'd want or that your patients wanted, So you keep coming into these dead ends, and sometimes there is no extra road, but sometimes there's a different path to take. One was doing the age management, so looking into that and hormones and things like that. That's another different path for female health as far as, face planting into your computer at 3 p.m. every day. Sleeping, with an infant that doesn't sleep, right? So that's being whole sleep deprived. So there's different avenues to try to get there. There's the traditional medicines, but over and over, you kind of hit this kind of wall, and sometimes you just don't know where to go. Or I don't want to take those medicines because, I don't have to go to the restroom all the time, but I have a dry mouth. I feel terrible on it. Mm-hmm. So really kind of came out of trying to solve the things that I can't solve all the way. Mm-hmm.
What kind of problems were you hearing, issues or complaints, from your female clients? Kind
of stress urinary incontinence, when you cough or sneeze or try to jump on the trampoline. And having had 3 boys, I had that too, trying to get one more thing done before you go to the bathroom and, didn't quite make it all the time, on that one. The other thing is vaginal dryness. Just the overall uncomfortable feeling that has, and then also that it lends toward having painful intercourse. So there's creams, but those pose different problems as far as you have to use that, let it absorb, and then, then you can be intimate or use it on alternate days, or it's a mess, they're expensive, or use lubrications. So sometimes people aren't candidates for hormone therapy, or they just don't want it, or for whatever reason, or they tried it and just didn't like it, whatever. And there's a gray area. There's, when you're 20, and then there's the truly postmenopausal 70, but there's this whole gray area, and people go, oh, I don't have to deal with, vaginal dryness, or I don't deal with that at all. And I think a follow-up question for me is, does your body keep up with your brain for intimate times? And if that answer is no, like, well, it takes me like 45 minutes or whatever. Well, there's all the gray area, you know, would like to try to get that to be more simultaneous or more in sync. So it's also pelvic, you know, laxity, or just having carried kids. You don't always have to have them vaginally to have a pelvic floor laxity. And so, you know, I'd refer to physical therapists a lot for pelvic floor training, et cetera. But sometimes that doesn't give you the whole success rate that you'd like to. Funny enough, I mean, this procedure actually found me, and I just did my research in it after I was made aware of it. It just was a flash of an ad. I was like, hey, what is that? And so it looked like, hey, this might really, really work. You know,
and what's the name of this procedure?
It's Votiva.
Okay.
And it's the in vogue term is vaginal rejuvenation. And it's different than some of the other procedures as far as using a laser. This is radio frequency. But it does all of the things that, you know, instead of having 3 or 4 different medicines or going to physical therapy for, they can work in conjunction and really have a great result. Or sometimes, you know, when people aren't candidates for those other things or have tried it and didn't have the results that they were looking for, we can certainly try this procedure and help people out. So the success rate or the patient satisfaction rate is about 93, 94%, which you usually don't hear for much things like that in medicine. Yeah. In my practice, the women that I've treated, 100% have had a positive outcome. And again, I can't say that for anything. Right, nothing. Nothing. You know, and I think it poses, as far as going into things eyes wide open. I mean, sometimes, you know, I'll look at a lady and say, look, this is not going to be your full answer. But her goal was not to have a full treat or a full success, resolution of it. She just wanted to get through the next year or so when her daughter was getting married and she had some other things planned, and to not, so that she didn't have surgery and maybe delay that a little bit. And that was achieved. It's been a really great, successful, and it's filled a niche in my practice that it's another thing I can offer patients. So it does have FDA clearance to help rebuild and restore blood flow to the vaginal mucosa and stimulate the fibroblasts to create collagen and elastin so that it supports the urethra more. So that's how it helps with the pelvic, with the urinary incontinence. It has FDA clearance for helping with pelvic floor dysfunction to help those muscles have better tone. So that, again, helps with urinary incontinence. And so it also, with rebuilding the blood flow, therefore restores the, the ability for the vaginal mucosa to function properly as far as lubrication. So it's been really great. It's been a good addition to the practice. And I don't think many women know about it or talk about it. I mean, I was the first one to have the procedure done because I was like, I am going to do a jumping jack again. So, and I can, and that's great. And I just think that is wonderful. I mean, my nurse teases me and she goes, I cannot bring you anywhere. Like, you are constantly talking about this procedure, talking about vaginas. And I was like, I know, but we don't talk about it. And you don't know that there's something else other than besides creams or pills that, you know, are a little bit more laborsome to use. And this is 25 minutes out of your day. So it's pretty awesome, actually. It helps. You can also use it for different things like revising scars. So when, you know, women tear in delivery, that becomes a scar. It's not as pliable. So this, you can actually use it to help revise that scar so that it is more pliable and so that it doesn't hurt.
Sure.
You know?
Well, I'm sure too. I know when we were talking about the show, I was asking you like, okay, what would you like to talk about? And you're like, vaginal rejuvenation. Like, all right. Well, I'm game. I definitely don't know much about vaginal rejuvenation, but I'm happy to. One is, I'm sure it's a topic that is somewhat taboo. And I feel like there's a need to almost like expose. Oftentimes, even the medical community communicates like wrong expectations, like after birth, or whether it be the medical community or just the general public of like, oh, you've had 3 kids, and how you're distressed incontinence, or you can't do jumping jacks. It's like, welcome to the club kind of thing. That's how all of us are, and it's just kind of part of the price you pay for having children.
Right.
But like you said, it's oftentimes a topic that's obviously a little bit more sensitive. But there's options out there. So when you brought up the topic, I was happy to bring it on the show so that if we have hopefully some women listeners that are intrigued, and maybe haven't had the opportunity to bring it up, in a physician practice that's a little bit more faster pace, right? I imagine that would be hard to get to a sensitive topic,
right?
When it's a little bit more rushed. There has to be, I'm sure, a comfort level of discussion to communicate that, no, this is not how it has to be. But there are, options. It's just a matter of finding what the best one is for you, right?
Yeah, exactly.
So with you mentioned earlier, as far as there being certain people that are maybe more candidates, like for the Votiva treatment, are there certain things that would make somebody more of a candidate versus less of a candidate?
I think it's certainly you can't have a stimulator, like a bladder stimulator or something, another electrode, basically. I've had patients with the mesh that we have done the procedure for, even though I've talked with a number of urologists, and they've all said, hey, as long as it's not through the vaginal wall and you can't feel it, then because the waves don't go deep and you're not going to damage your organs, you're not going to do any of that. So it's safe to do the procedure. You always want to have a pap smear that's normal. So you don't want to do it on somebody that has an abnormal pap smear. So we always want that on file within 2 years, even if you're over the age of when you can stop forever having pap smears. That would make me sleep easier at night.
Sure.
It's not for those women who, some people have too much tone, too much pelvic floor tone. And so this actually helps tighten it. So that's not the right patient to do this for.
With somebody with that type of presentation, how do you treat that? Like too much tone?
Too much tone? I think that's a lot. A lot of the times they need a lot of different help between GYN, between physical therapy, and sometimes even counseling. So,
yeah.
But I mean, it works really well for people who are, just had a baby. Obviously, let yourself heal all the way, right? But within a couple of months, you can certainly use this procedure to help out. It even does cool things for stretch marks, so that's pretty cool too. I think it's honestly most women are candidates, honestly. I mean, whether you've had kids or not, still hormones change, and it can do different things to the mucosa as far as not having as much estrogen support and then the tissue and the mucosa get more thin and fragile. So rebuilding that and getting it back to normal function is what it's about. So,
as far as the treatment itself, what could somebody expect how the treatment goes, or is there certain is it kind of one and done, or do you find there's a certain kind of recommendation frequency, or if you talk a little bit more about that?
Sure. I ask that people shave the area about 2 to 4 days prior to the procedure. Not that it's going to hurt or do anything bad. It's just that sometimes, obviously when you have a wand that has conductors and it's surrounded by plastic, sometimes, hair gets pulled, and I don't want to put people through any other discomfort than I have to. And the idea is that you heat the skin up to a certain temperature. So if you're not getting full contact with the skin, then it's not as effective, right? So that would be the only prep. You don't have anything else. It lasts 25 minutes.
It takes 25 minutes to go through the treatment. It takes 25
minutes for me to do the procedure. There's no pain at all.
Do you feel the warmth?
You do feel the warmth on the external, but you really don't feel anything but kind of pressure on the internal. So there's no pain at all. I know that it's more anxiety provoking as far as, wait, there's no pain, there's no what, but it's capped at 107 degrees. So your water heater is at 120. That's kind of how I put it for people. It's like a warm bath when you're sitting there and going like, it might be hot. No, it's not. It's okay. There's no restrictions on your activity afterwards. We just ask that you don't have intercourse for 2 days. That's it. I can go up, go work out, go to a grocery store, just do whatever. So it's really neat. I've got ladies who've been very, I'm thankful that they've let me take before and after pictures, obviously anonymously and with their permission. But for educational uses, because at this point these are my cases. This is what I've done. These are my results. And it's really remarkable. It's like a magic eraser, Mr. Clean magic eraser, and it does remarkable things. So the initial treatment is 3 sessions, 1 month apart.
Okay.
And then I leave it up to them about when they start feeling symptoms again. Yes, it's recommended by companies and some of the GYNs that also do this procedure that you do a touch-up every 2 to 3 times a year. I've just not had that experience as far as I've been doing this about 16 months now, and a couple months ago, I just started doing touch-ups. And I've been calling the people that I've first initially done the procedure on just to touch base with them. Like, hey, how are you doing? Are you having anything at all that would make you think like, hey, I probably should do a touch-up? Because obviously you don't want to get back to where you were before.
Sure.
So...
the touch-up is usually just a treatment.
One treatment. Yeah.
So most people going through once a month treatment for 3 months will take care of really most things. It sounds like, and brings with the success rate that you mentioned, 93% or
patient satisfaction rate about 93%.
Okay.
Yeah.
I was gonna ask you too. I know I heard on the radio as far as I don't know if there's any similarities as far as the wave for men for erectile dysfunction. Is the technology, is it similar, or just wondering on that front?
Yeah, no, it's totally different. It's a low wave or a low frequency. It's lithotripsy actually.
Okay.
So I don't know. Maybe they'll do some more studies with the radio frequency. I mean, the concept seems that it should have a positive thing, if we're talking blood flow, right? So, I guess we'll see.
Right.
Yeah.
All right. Well, I know we've talked about Votiva and treatment. Is there anything else that you'd like to add before we move on to the next segment and finish with our little rapid fire questions?
Oh, not really. Just, with it becomes some aesthetic stuff that you can do with the Votiva and that platform. And that's just fun stuff as far as helping with, scar revisions, or if somebody has acne scars or stretch marks or anything else like that. So it really does tighten and tone the skin that you're treating.
Wow.
So, but that's kind of just fun and on the aesthetic side, I guess. So
have you I guess used it in those purposes?
Okay. Yeah, and what's really neat about it is that this is one of the few skin procedures, I guess, that people of a darker skin complexion can use without fear of getting scarring. So, because that's usually not an option for them. So, it's neat.
Awesome.
It's really cool.
Well, we'll after we get through the rapid fire, we'll make sure to get your contact information. So, people are listening and interested. And before we do that, though, do you if somebody was interested, do you usually do some sort of like first appointment consultation, or how does if somebody wanted to take that next step, what would that next step be?
Just call the office. We'll get you set up for an appointment, and I'll do your full history and physical and make sure, hey, this is, your expectations or concerns will be adequately addressed with the procedure. I mean, I don't want to, obviously you got to pick your patient and the procedure have to match. So, but yeah, we'll take it from there. Just say, hey, I heard it on the Stay Healthy podcast.
That's right.
So we'll take it from there.
Okay. All right. Well, I'd like to transition with all our guests, getting some rapid fire kind of questions, answers about Knoxville specific things they enjoy. So, Dr. Ayo, the first question is, what's one of the favorite places maybe you have not been to, kind of on your bucket list for Knoxville, East Tennessee, that you would like to go experience?
I really want to go to that Lost Sea tour. I think that would be pretty cool. I think the boys would enjoy that too. And I also, because I think Ruby Falls is pretty darn close to that. So I'd like to take him to that too.
Yeah, I went, and I was elementary school growing up here in Knoxville. It was probably, I don't know, third grade. That's my memory of like the Lost Sea. It's kind of one of those things, like you still remember it from a perspective of, a 10-year-old,
right.
Type
and
thing.
everything is huge.
Right. So, yeah, that's a place I'd like to go back just to see how, my memories of it, how real they actually are. But yeah, I remember getting on that was, I'm 36, so it was a while ago, 20 something years ago. So I don't know how much it's changed. It one of those places probably hasn't changed that much because the natural phenomenon. All right, that's a good one. I haven't had the Lost Sea mentioned as far as a guest, so that's a new one. What's, as far as one of your favorite places to go to enjoy outside around Knoxville, your go-to spot?
Crazy enough, it's actually Lakeshore Park. I think it has spectacular views right up at the top of the, the walking path. And sometimes whenever I just need to sit and think, I'll just sit on that bench, provided nobody else is on there, I guess. But overlooking the river and the mountains, but the boys play soccer there a lot, so I walk around there. I used to do it a lot when they were babies and pushing strollers everywhere, but I think it just has a nice variety of stuff, and it's close.
Yeah, it's easy to get to, and definitely.
Yeah.
All right, and then what's your favorite restaurant, Knoxville restaurant?
Well, we just tried Elkmont Brewery the other night, and that actually had some really nice food. I liked it. Plus, they had some New Orleans fried boudin balls, so I had to have that.
What's
for sure.
A
boudin ball? Yeah, so it's a concoction of just meat and spices and seasoning, and usually you make it into what?
Like a meatball?
I mean, I guess.
Okay.
But but it's usually in sausage links.
Okay.
Right. But you don't eat the casing typically, but you'll bake it and then kind of just get the inside out.
Okay.
Really. But a boudin ball is you take the filler, and I mean, I guess it's sort of like a meatball, but it tastes nothing like a meatball. I don't know how else to explain it.
Okay. I guess you'll have to go.
You just have to
go. Brewery and try.
Their boudin balls.
Boudin balls.
Yeah.
Okay. All right. So we got even more than your favorite restaurant, favorite dish, or
it was pretty good.
Recommend to.
Yeah, it was really good.
I'll have to try that out. I'd like to end with what's your best recommendation tip for staying healthy for our listeners here in Knoxville?
It's going to be pretty boring. But I think it really all comes down to diet and exercise. And I cringe when I even have to say that because, I mean, it's not the answer I want either, but it's certainly true. And over and over and over again. That's the outcomes of studies over and over is diet and exercise.
Yeah. So many people try to like kind of bypass that piece.
Yeah.
And kind of move on to the next thing.
I kind of do. I would love to bypass it. I mean, sometimes, I just told you before that we recorded this, I just ate a chocolate covered piece of toffee. Probably not on the diet and exercise list, but it was sure yummy. So, but yeah, I think that's the basic key is diet and exercise.
Definitely. All right. Well, Dr. Ayo, thanks for coming on the show. For people that are interested in either your practice, concierge medicine, or your other, treatments like Votiva, things that you do as well, what's the best way for them to find out more or to contact you guys?
Probably the easiest is the website. It's www.fhcpllc.com, or you can Google my name. And that'll come up.
How do you spell your name?
Oh, Raye-Anne, last name Ayo. I know.
That's
very
right.
Southern.
And you have to get the hyphen in there. I'm a hyphenated name too, so we share some like
take the hyphen.
We have some like deep connection with our hyphenated first name. So
yeah,
this is going to be a good podcast when I saw that hyphen.
Right, you have to have the hyphen. So everything's on there. Either links to either the procedures, the phone number, requesting an appointment. Everything's on there. Okay,
and we'll put a link in the show notes that you can find with your guys' phone number. What's your phone number too?
It's 865-675-4342.
Okay. But we'll put all that in the show notes for people to look up if they didn't catch that. So where they can access Dr. Ayo and find out more about her services and her practice and how she helps to serve the Knoxville area with her expertise in medicine. So thanks so much.
Thank you
for coming on the show.
Thanks for having me, for sure.
We appreciate our listeners. Let somebody else know about here in Knoxville about Stay Healthy Knoxville. We love to spread the word about spreading health and good practices and ways to tap into what Knoxville has to offer here locally. Thank you.
Thank you for tuning in to the Stay Healthy Knoxville podcast, brought to you by Simply Physio. If your pain is preventing you from staying healthy and active and you'd like to avoid surgery, pain medicine, or just want to get back to doing the things you love in and around Knoxville, we offer both a free ebook and free over-the-phone consultation to help you figure out the root cause of your pain and the next best steps for resolving it. Find our ebooks online at simplypt.com/health-tips. There you will find ebooks for topics such as neck and shoulder pain, lower back and hip pain, knee pain, and TMJ. These quick-to-read reports will provide you with expert tips, tricks, and exercises to help solve your pain from the comfort of your own home. Just visit simplypt.com/health-tips to download your ebook and have it delivered directly to your inbox. We also offer free, no-obligation phone consultations with a doctor of physical therapy to Knoxville area residents. Just call us at 865-351-0615 or visit us at simplypt.com and click the Talk to a PT button on the home page to schedule a call with us. Thanks again for joining us, and we will see you next time on the Stay Healthy Knoxville podcast. This has been a Humble Pod production. Stay humble.